Hi, everyone, and welcome to this week's podcast that we're doing with Vets I Recommend. I'm so happy that you guys are here, and I'm really excited that you're getting to meet all of these veterinarians that I brought to you, and hopefully you're going to learn so much from them, such valuable information. With us tonight is Dr. Katie Woodley. Hi, Dr. Woodley.
Hi, thanks for having me, Carrie.
Oh my gosh, no, thank you. Believe me, we all thank you guys for giving up your time and I know you know what a struggle it is to try to help heal these pets and get people on a different mindset and that's why you know she comes on and she's going to talk to you. So if you have any questions, type them in. We're going to get to them. I always tell you this just for safety purposes. None of the veterinarians can diagnose or treat your pets right here, right now. So this is just information to help you, guide you a little bit. You can do with Dr. Woodley. She does some consultations. And tell us a little bit about what you started doing and why you started doing this to help people.
Yeah, so recently, a lot of us integrative holistic veterinarians, we have backlogs of people because unfortunately there's not enough of us. And so there's only so many patients we can see in a day. And we all have such huge missions of helping pet parents. And, every day I'm hearing people coming to me and asking for help, and they've lost hope. They've been told there's nothing else they could do. And I was like, we have to fix this.
Yeah.
And so what we started doing is we created a program that has an educational component that guides pet parents with the principles and those foundations of helping to solidify those foundations of health. So physical health, gut health and nutrition, immune health, emotional health, and environmental health. So it essentially teaches you what I teach my clients to do to help heal their pets or prevent disease in the first place. But the neat thing that I found was because there's so much information out there, right? So you can end up down the rabbit hole researching for
Oh my
hours
gosh.
and
Yeah.
hours, right? So,
Yeah.
I find myself in the hole for hours and
I've been in
hours.
that hole.
We've all been in the hole.
Yeah.
And so here's the thing that I wanted to do with this program is not only give pet parents that information to guide them that they can refer back to throughout all life stages of their dogs and cats, but there's also a private community where there's no stupid question, right? And, a lot of people are afraid to ask a question and be shamed or feel guilty. So it's a really like-minded community, safe place to go. And then we also do 2-hour weekly Q&As with me where you can ask those questions and get guidance. So if something pops up or you're going through the program and you're like, I don't know where to start, my dog is itching, they have allergies, what should I do? Those are where I answer those questions and help guide pet parents. So it's a lifetime program. I'll share the link with Carrie. So I do calls with every single person to make sure that they're a good fit for the program. So we have a kind of a webinar that we've done in the past that explains it a little bit more. So I'll share that with Carrie afterwards if it's something that everyone here wants to take a look at and see if it's something that maybe would fit into what you need and what you want for your pet care.
Yeah, I think it's important to talk about. Hi, Terry. Hi, everybody
Oh,
coming in. Thank
Terry.
you.
Hi,
Welcome,
Terry.
welcome. I think it's important that people understand that it has to be a good fit because a lot of times I know just for me, and I'm not a veterinarian, everyone knows that, but even when I'm trying to guide people on skin, like they want to, we were talking earlier before this went live about people bringing me their medicated baths, and I may not be a good fit because I'm really uncomfortable doing that. And then they want me to do it. And so it becomes this anxiety from both of us because
Mm-hmm.
they know it's not a good fit. So it is important because it's really hard, right, for you to try to guide somebody who's not comfortable with doing it. It's
Correct.
really
Well,
makes it hard.
yeah, one of the things I find too, and this is something that I go through to make sure they are a good fit, because I don't want someone that's, it's not a good fit, because that's
Right.
not fun for anyone, is, we have this difference between conventional medicine and a more like integrative holistic approach. And they're very different worlds. And
So different.
there's necessary parts of both, right? Well, for conventional, like there's a time and a place for conventional medicine for more like acute injuries. Say your pet gets hit by a car, like we need to use conventional medicine for those emergency cases. However, from the holistic side, when we're looking at the pet as a whole, we're asking very different questions. We're asking, like, why is something happening? What is the root cause of that disease? So rather than just treating a symptom like itchy skin, they're chewing at their paws, they have an ear infection, we're asking, well, why? Why are they chewing at their paw? Why are they getting an ear infection? So it's a very different question that we get a very different answer for. And usually, if we're following that path and we're going down that investigation, we're figuring out why. It takes time to heal the body. And that is what's different. So I find that sometimes pet parents will come to me and they're still stuck in that conventional mindset. They want, we're so used to having a drug and a result right away, right? You take ibuprofen for a headache and your headache's gone in an hour. But if you didn't fix the reason why you had the headache, when that medicine wears off, the headache will probably come back. And so this is where I always make sure that people understand, like, it is different what we're treating, and we're looking for fixing the problem, but it doesn't always happen overnight. Sometimes we get fast results, but a lot of times these pets have been having issues for like years and years, possibly even all life. Like, so 10 years, and they're coming to me and they want to see results within a month. That's very unrealistic. It's a nice goal to have, but if someone's expecting results that quick, it's easy to get disappointed and dismiss this entire amazing world of medicine that can actually heal your pet and fix that root cause of disease. So that's definitely one of the things that I talk to people when I work with them personally, when we're working together or potentially going to work together in that program too.
Patience is so metronidazole. I'm going to kind of
Oh yeah.
along that line. It's like metronidazole is one of those traps that people get in, and I see it over and over and over, where they start the metronidazole and then it clears up the diarrhea, and then it comes right back.
Working as well anymore, I don't think.
Right. And then they're on the lifelong metronidazole trap. And it's as soon as I take them off it, I got to put them back on it. And it goes on and on and on and on. And you're right, because we are trained that we want the instant fix. I love how you use the ibuprofen for the headache, because we do. It's a perfect example. We want to come in, pay our doctor, go to the CVS, do whatever it is, and we want to fix it. And if we're not patient, then we get frustrated with our holistic veterinarians, right? Well, this didn't work. They're just a bunch of hoopla crazy people, because it
Maybe
didn't work.
slightly,
Huh?
but in a good way.
Yeah,
A little
but that's
crazy.
because they want it to fix quickly, and they have to understand the patience of how many layers there are of healing it. Like the skin, for example, right? If we do the right for the outside of the skin to make the dog comfortable, we still haven't addressed the root cause, which we have to, or it comes right back. Now your dog's itching again, and he's scratching and all of those kind of things. So it's an epidemic. Wouldn't you agree? I always say that people are shocked that I say we see this every day, and you do as well.
I mean, well, the thing is with what I do, I mean, I'm usually seeing people that, I'm like the fifth or sixth opinion.
Yeah.
They've gone through a ton of different doctors and they've had no results. They're now to like the end where there's nothing else left, according to, those doctors. And,
Yeah.
I'm always of the mindset, like I'm a very hopeful person just because of like going through this with my personal pets, going through this with like my husband with autoimmune disease, and learning about all these different modalities. Like, just because I may not have the tools to fix your pet doesn't mean someone else doesn't. And
Yeah.
that's the beauty of this, is that we have this entire different world of medicine that can tap into energy, can tap into the emotions, can tap into detox, can tap into homeopathy, can tap into Reiki, can tap into Chinese herbal medicine, acupuncture, laser therapy, ozone, like food therapy. Like, it's incredible, all the resources we have, and we're all trained in these different areas. And so just because one doctor, it may not work, or the pet, I find if pets are really, really sensitive, that's where maybe using something like homeopathy. So, Chinese herbal medicine may be a bit too strong for them. And that's where I can refer them to a colleague that practices and is trained in homeopathy. So my mission is, ever since my husband was told there was nothing else he could do for his autoimmune disease other than strong immunosuppressives back in 2014, I am on a mission to never say that ever again to one of my own patients or a
Yeah.
client, because it is the most heartbreaking words that you can ever hear in your life. And that feeling, I still feel it in my stomach thinking about that day in the doctor's office. And I think about those patients, those clients that I told that to, before I knew this world existed. And so
Yeah.
I'm not okay with that anymore. And I'll do my best to help these pets and help the people and, tap into this amazing world of other medicine that we have. And it's it's not always easy, and it's kind of a long path sometimes, but it's like it gives you so much more hope, and it helps. I mean, you feel empowered once you realize that there's so much more you can do.
I think that's the I had Dr. Bakarin on last week, and we were talking about why we're so passionate about this journey that we are all we've all come here for different reasons, but now I feel like, even though I'm not a veterinarian, I feel very much on the same path as wanting people to understand. And I talked with Dr. Bakarin about how we got there, and yours is very unique because it was through your husband,
Mm.
but it's still also the same, is that you saw results. And when you see those results, when you're told no, 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 and then you're like, well, wait a second, this actually worked,
Hmm.
it makes you that much stronger in your belief system. And that's why, right, you just, when I see these animals that actually are healed and never have to go back on their
Yep.
apoquills or their metronidazoles or their, you know, all of it.
Well, yeah, and I mean the thing too is that so I was lucky because, we went through that with my husband and I woke up. So I became trained in acupuncture and then Chinese herbal medicine, food therapy. So fast forward a few years, and then we had three pets develop cancer. And so the two cats were closer to the start of my journey, and it was pretty aggressive GI lymphoma. So we didn't have a lot of time with them. But then Finn, my like soul dog, my German Shepherd, who's a huge part of the mission now, like when he started having seizures. And of course, he's an older German Shepherd. I was like, he probably has a brain tumor, realistically. And we did a CT scan and diagnosed a brain tumor was the cause of the seizures. And that's when I stepped into the shoes of a lot of my clients, because I'm not against conventional meds. Like, he's having seizures. We need to stop them because they can trigger them more. The CT scan showed a lot of brain swelling around the tumor. The neurologist was shocked that he did so well for his anesthesia. He was on herbs, and we avoided knee surgeries for him. He was a 75-pound German Shepherd with everything else we were doing. And we put him on the conventional drugs, and he stopped eating for the first time in his life. He couldn't walk. He had vomiting, diarrhea, and he did awful. And I said, we can't do this. And we couldn't do we could do radiation, or we could do brain surgery, but radiation would most likely leave him blind because it was right next to his optic nerve. And brain surgery, I just don't see the outcome of it being the results that I'd want to put him through that. And so we ended up, I was told, I said, we can't do these drugs. And she said, well, you know what I would do is I would love on him for a week. And if you get a week, great. If you need to bring him back sooner, then we can help you put him down. And so I was told there's nothing else you can do. And I said, thank you. And I walked away, and I didn't say this out loud to her, but I was thinking, that's fine. I'm going to do my things. And that's where people who are in that situation, if you know that this world exists, you don't walk away defeated. Yes,
Yeah.
it was super sad. It was hard, but I was like, okay, here we go. Like, let's make some adjustments. Let's tweak the things we need to, because this is all we got now. We
Yeah.
can't rely on this other realm of medicine because he doesn't do well with it. His quality of life is in the toilet. We have to do our things now. And we adjusted his Chinese herbs, did his acupuncture sessions. I tweaked the points I use. We changed his food, and we changed his supplements. He was on a lot of CBD, and we gained another year of amazing life with him. And we had very few seizures. And then we got to a point where he was done. Like, he
Yeah.
had a bout of seizures and it was continuing. And that was the time, like, okay, we got him through to the point where he is done now. And he did amazing. He had a lot of experiences. We have so many more memories and pictures with him. And no one even knew he was sick. Like, our
Yeah.
neighbors didn't believe us. They're like,
Yeah.
how's he have a brain tumor? I'm like, I don't know. It's great. Like, he walks twice a day. He's running around like a hooligan and doing all
Yeah.
the things, going up to the reservoir and swimming and going to the river. So that showed me how important it is to like keep learning, to keep pushing on, to keep questioning, and to also make sure that, we have these tools in our toolbox.
Yeah. I think that's the one thing I wish conventional veterinarians would do, is be better at saying, I don't have the correct
Mm.
tools, but maybe somebody else does. Like
Yep.
you're saying, it's really, in a way, it's arrogance, because they know that you guys are out there.
Yeah.
They're not living under a rock. They know there's other tools. It's just that they don't understand them, and so they give the answer, there's nothing you can do. I would go home and see if you got a week with your dog. And I
Mhm.
see that all the time. I have a dog right now, Echo, and they were basically telling her there's nothing you can do, and he's got a yeast problem, and it's bad. It's one of the
Mhm.
worst yeast problems I've ever seen, and it is horrific, and it's all over his body, and he's miserable. And the vet just told her there's really nothing we can do except keep him on, you're gonna maybe giggle a little, keep him on antibiotics. And he's supposed to live on these apparently, and he's a young dog, so I'm like, oh,
Oh.
he's so young, like I know we can do better. So, but I
Mhm.
wish they would be better at saying, I don't have the tools, but maybe
Yeah.
somebody else does. And not be so afraid to not know, because I feel like
Yeah.
vets come out of school thinking they're supposed to know all of it. And
Mhm.
I think if we could do a better job, even our holistic veterinarians, right? You have some really good, amazing holistic veterinarians, and maybe they aren't so familiar with ozone,
Mhm.
and maybe they can just refer somebody that has ozone. But I think holistic veterinarians, maybe you will agree, just because a lot of them are more open to doing that.
Yeah. Well, and I think too, a lot of us found this journey because of either our like
Yep.
their own health problems that weren't resolved by conventional medicine, or they had pets. Like we all have personal stories that for some reason or another, we found this way of medicine because it's not because we were taught it in vet school. Like
Yeah.
I remember in vet school, I took a week of like a special interest training, and it was like some muscle testing. And I can't remember all, it's been too long now, but it was like people were just like laughing about like it was a joke. And I was just like, I wanted to learn about it because I knew I would be coming back to the state because I was in New Zealand for vet school, and I would be coming back, and I knew that there were a lot of people really interested in it. And I kind of had a special, I always
Yeah.
I don't take a lot. I don't take ibuprofen. I don't know the last time I took ibuprofen. I use like other things instead, or, wait it out. But so it was like one of those things where like, wow, people think this is like a big joke anyways. And I
Yeah.
was, yeah, so you don't learn about it in vet school. I know there's a couple vet schools that are there, they are more open to it. They're teaching it. There's some acupuncture trainings. That's good. But overall, like I feel so bad for the vet students. I know a couple of them that are currently in school, and they can't question anything. They can't question the food. Like they're
Nope.
afraid they'll get kicked out.
Yeah.
And that's really, really sad. That's a really hard position to be in. And I've had people that come to me and they're like, I want to be a vet. And I'm like, maybe you should go on like the human holistic side and then do some certifications in pets and like
Yeah.
coach them. Like, I'm not trying to defer people away, but like I can't right now. I would get kicked out of vet school if I went back.
I
Like,
would
there's no way I
so
would
get
make
kicked
it.
out.
I wouldn't make it.
Yeah.
Like,
People say that to me all the time. How come you don't go to vet school?
right,
And
then,
now it's just because I'm too old. And I mean, I'm not too old. I don't want to take that away from that. But I have my business, and it's doing really well, and I'm really happy with what I have. But if I went to vet school right now, I
it's
would get kicked
stressful.
out. There is no way I could. I could not keep my mouth shut. I would
I
get
know it'd
kicked
be
out.
hard.
So in a weird way, I'm glad I didn't go to vet school when I was younger, because it scares me to think that I would have been manipulated in, not, I don't know if manipulated is the right word. Maybe it is. Um, but I feel like if I would have went right out of college, and I'm 20 years old, and what if I would have fallen in that? Maybe I wouldn't have had the experiences that you had with your husband or with your dog Finn, and maybe I would have just believed it and be sitting there prescribing all these medications. So I'm really glad and happy of the path I'm on. But I want to move into, and I am so glad, and I knew you were going to be the right person for us to talk about this. So last week, I had an email come across from, she actually happens to be a client of mine, and she's struggling with her dog who has seizures.
Mm,
So I'm like, oh, Dr. Woodley's going to come on. She's going to be able to help us. So let me give
yeah.
you a little bit of a background, just to kind of get your advice. She is going to be calling you and sending you everything. But for now, just so we can help other people maybe understand the path. So she has a little dog named Sadie. She's a little Maltipoo. I can't remember exactly how old she is. She's not very old though,
Mm,
but she had one big giant, what mom thought was a seizure. Mom never knew what one would look like. And so she rushes her to her veterinarian. The veterinarian says, well, it's the first time you've ever noticed this, so let's not do anything yet, which she was out of it by the time she got in there. And she
Yeah,
seemed
usually
pretty much,
they are.
yeah,
Yeah.
yeah, she was completely back to normal. Um, and the vet said, that's kind of fair, right? It's the first time you've ever noticed anything. I didn't think that was a fair thing, but unfair thing. But then while you're here, we'll give your dog a rabies vaccine because she's due.
Oh no. Oh,
Okay.
that happened?
Yes, that
Oh
happened. That
no.
absolutely happened.
Okay. Oh no.
So
Oh, that breaks my heart.
it broke mine too when she told me that. And
Oh
she didn't
no.
know. Mom didn't know. She
Yeah.
thought, oh, yeah, she's due. And they went ahead and gave her the rabies vaccine. She is now, so little background on her. No, she's not on any flea or tick medications. She's got her on a really good diet. May not be the right diet, but it is a good diet. She's eating some small batch right now,
Okay.
doing that kind
Raw?
of a, yeah, yeah.
Okay.
So she's eating a raw small batch diet. What her question is that, and I have not heard of this drug, so I haven't been around in the vet world for a while, but you'll know what it is. Zunizmide or zonazmide?
Zonisamide is yeah,
Zonazimide.
it's an anti-seizure drug.
Yeah. Oh,
It's
I
like a
knew.
newer, well, it's not new actually. It's been around for a while. So
Yeah. So I hadn't heard about it. She's on, so she says Sadie has been taking zonazimide, however you say that, 25 milligrams in the morning and 50 at night for close to a year now to help prevent seizures. Oh, she's 5 years old.
okay.
She was diagnosed in 2021, but she's really concerned because she hasn't had any more seizures. She wanted to, if she's going to keep her on this, she wanted to give her just like half of that dose, but the vet was very adamant that she had to give her that whole amount. And she wants to start looking towards ways so that she never has to give her this meds. It makes her really groggy.
Yeah.
Says her breathing. One of the nights she gave it to her at night, and her breathing was just almost. She thought she died, like she was dying because there was no breathing in there. But do you think? I know you had mentioned a few minutes ago about how sometimes you have to keep them on that because if you take them off, the seizures can get worse.
Yeah.
But do you think that for a little tiny, she's 5 years old, do you think that seems like a lot?
Well, I'd have to look up, like, I don't know the dosage off the top of my head
Yeah.
because I honestly haven't prescribed that in like probably 10 years. So
I had
it's,
never heard of it. I
I
mean,
mean, I've had clients that have used it when their dogs had multiple seizures. So here's the thing. So she's only had one seizure, correct?
right.
That's it. Okay. So here's how I approach seizures. And Finn, my German Shepherd, was different. Like, usually when we're diagnosing seizures early, well, so when we see them, what we call it is like idiopathic epilepsy. So idiopathic means we have no idea why it happened. And so with Finn, we knew why it happened. He had a brain tumor that's triggering the seizure. So if we take him off of stuff, then, and he wasn't on that drug, he was on his medication that we had him on that he did like fine with. Like, he did not do well with like your traditional like phenobarbital, so your Keppra, he was also on like originally steroids, and that did not do well for him to reduce the brain swelling. So if you reduce things, like, he's going to continue to have seizures potentially if you're not doing anything else. So when we diagnose seizures in a younger animal, it's typically idiopathic. So we don't know why it's triggered. We have our theories, right? Mine, for one, like, vaccines can cause them. So the fact that, I don't know if she had one previously before that could have potentially primed the body, the immune system. We live in a toxic world, so toxins. This is where right now we're in spring, so flea and tick preventatives. There's an entire class of flea and tick products that cause seizures and are awful, and I will never recommend them ever again after seeing too many patients that have neurological issues. So things like NexGard, Bravecto, Credelio, Simparica, do not use them. Use your natural products. I honestly, like, fleas and ticks, use your natural stuff. So that would be another potential trigger for seizures if that had happened. So that's how I look at like patients is, are there toxins? Have there been vaccines? Have there been like antibiotics or other drugs? Has there been something like a change in the household? Has there been like trauma that's occurred, like a head injury, they fell off something, they had a seizure? So we want to look at potentially finding the why. The other thing that I would say for her specifically, especially for younger animals, do we have congenital hypothyroidism? So this is where blood work should be done every single time. If there's a seizure, even though we're going to say like, oh, it's one, we don't start them on medications typically with just one. That's usually not the treatment plan from a conventional side. Like we're taught to like wait, because these medications, as she's seeing, have side effects. They're strong. They can affect
Yeah.
the liver, they can affect the kidney, they affect the behavior, how they feel. So doing a full blood panel, so a CBC biochemistry, and also getting at least a T4. If you can, I would do a full thyroid profile. So you're also looking at autoantibodies against the thyroid gland. So that's important, because sometimes that T4 level can be completely normal, but we have an autoimmune disease process, but it's not progressed enough to drop that T4, that thyroid hormone, low enough on a routine blood sample. So this is what I would definitely be ruling out. And here's the thing, thyroid medications can affect the T4. So now we're in a place where it's like, if it comes back low, is it because of secondary like disease that can drop it low? And it's not true. But that's where, if she does a full thyroid panel, she'll get an idea what's the thyroid stimulating hormone, so TSH, what's T3 doing, like free T3, free T4, and then your auto antibodies. And they can have it sent to MSU, Michigan State University. They can have it sent to HemoPet. So Dr. Jean Dodds runs those also. But I would be definitely doing, and they should have done this before starting any of those strong medications, because what if there's a liver issue? What if there's a liver shunt? These are all potential causes for a
That's what's
seizure.
so weird to me is that, do the diagnostics. Like just try to find out
Well,
what you
and
can.
starting a drug too, because now if her liver values are elevated, were they elevated before, or is it secondary to the drug? So now this is the thing, like I always recommend this too, before starting things like CBD or, some of these supplements also, always get a baseline. Because what will happen, especially if you're working, say, like I do a lot of telehealth and you have a conventional vet, if we don't have a baseline before we start using things, how are we going to know if it's due to supplements, if it's due to a change, if it was already there before? So it's a great way to adjust and see how what I'm using is affecting the body. So it's so important. Yes, it's an expense, but it helps tailor how we do our treatment plans and how we can assess how it's working for our patients. So 100%, I would have her go back in and just get the blood work anyways. I would say also, like with one seizure, I would be doing my best to have that lower that dosage and get them off. Usually, from my understanding, and I'd have to go back and see if anything's changed,
Right.
because it's been a long time since I've used like that drug. It's not usually your first line treatment for seizures.
It's
It wasn't
interesting.
back then. I don't think it would have changed. I mean, for my patient, one of my recent pets, um, 2 years ago, I think it was about 2 years ago, that had seizures, really, like she was on 3 different seizure medications. And
Wow.
zonisamide was the last one that was added. It was like a breakthrough seizure treatment. It wasn't the first one. It was like phenobarbital, your Keppra. Those are gabapentin has anti-seizure properties too. So it's, yeah, I would definitely be looking at doing a full blood panel. Like things like brain tumors, very low like risk of that being the
Right,
cause of the
right.
seizure, especially since there haven't been any further. So this is where, like, let's rule out endocrine disorders. Let's make sure that there's not a toxin. Like, we do a lot of hair tissue mineral analysis tests too that look at like heavy metals. Like, is aluminum really high? Like everything, like we live in a toxic world. Glyphosate is everywhere. So that's Roundup, the pesticide, herbicide. It's in our drinking water, it's in our food supply, it binds to heavy metals, specifically aluminum, and it'll actually carry it to the brain. So if this dog is really, really high in aluminum, I've had some dogs that were like in the 60s, they should be at zero, really, really high. And they had behavior issues and all sorts of things. And as we start detoxing them and drawing that out, there's specific ways to do that. They start feeling a lot better, because heavy metals, I mean, we shouldn't have heavy metals, but every single dog does. It's
Yeah.
just what level is it? And so there's so many different tests. So, rather than just drugging them, let's try to see like, okay, are they going to have another seizure? But also, here's the thing. So at least they're on like a raw food diet. So if your pet's having seizures, getting them off of high carb diets, because for one, a processed food diet is going to be very warming. Seizures are a warming disease. We don't want to put foods into the body that are going to increase the temperature, because that can actually make it more likely for them to have a seizure. Also, carbs aren't good for helping with seizures. So we want low carb diets. A lot of times going to like keto diets can help specifically for that, for seizures. And then I'd also be looking at CBD. CBD is what like truly helped Finn. That was a huge part of his treatment plan. But then also we use specific Chinese herbal formulas based on his pattern, but also based on like, typically like treating seizures. Yang energy is rising from Chinese medicine perspective. Yang energy is like bright, vibrant energy. There's too much. It's going high. It's creating those seizures. So we use Chinese herbs that help resolve that imbalance and get a better flow of the qi, the blood, the energy, reduce the heat, help with that, reduce phlegm. And like brain tumors are what we call phlegm, like in the brain. So he was on specific herbal formulas to help with that. So it'd probably be a little bit different for her. But there's so many things you can do to help naturally prior to doing those strong drugs. Like that would be my last resort for like a patient right now with this idiopathic epilepsy. I would
Right.
be doing all these other natural things, doing those diagnostics. And then if we started having like cluster seizures where they're having seizures back to back, we need to use stronger drugs because it triggers them to be more likely to have another seizure. So, but one, I would have done it a little bit differently.
Yeah, it's heartbreaking because that's one of the hardest parts about my job is I know her dog very well, and then I get attached to them, and I'm like, oh,
Yeah.
I want to do this, but it is so scary for the I should say average person, but for the pet owner that hasn't ever seen an animal and now it's their animal have a seizure.
Seizures are
They're
hard.
scary, and then they don't want them to have another one. So when they give you this drug, that's where she is right now. She's afraid to take the drug away and have another seizure happen. And so I told her, I need to get you hooked up with somebody who is going to give you a little bit more confidence that,
Yeah.
maybe going on the CBD and weaning them off of this and seeing where we go there. But I'll have her contact you.
Yeah.
I'll
I
give you
mean,
all her information.
so
Dr. Dodds is very close to us, so I can have her go over there and get the blood work done and all of that kind of stuff. So
yeah. I mean, to anything, like if like for people that are listening, we always have to look like at those bigger, like I talk about 5 pillars, like the foundations of health. And so is there a gut health problem? We have a lot of diagnostic tests now, like animal biome, where we like the pet parent can send in a stool sample and get an idea what's the level of dysbiosis. So are the levels of bad bacteria, good bacteria off? Do we have good variety of the different strains of bacteria present? That directly affects everything.
everything.
You have, 80% of the immune system in the gut, and we have the vagus nerve that's directly connected to the gut health, leading up to the brain. That could be causing an issue too. What's going on in the environment? Is it really stressful at home? That can, that could potentially lower the trigger for seizures. What's going on with immune health? That goes back to like vaccines, asking for vaccine titers, not using your flea and tick products, making sure if you are in an area where you need to use like heartworm preventatives, like we're not using it every 30 days. We can use it every 45 days. It lasts 55 days. It's treating the last like 2 months, and you
Yep.
can detox the body. Make sure we're using things like Interceptor, not Interceptor Plus. Like we don't need the dewormer product, so we're less likely to take out the microbiome. Like these are all things that we should, regardless of the condition, we should always be looking at. And something I'm very sensitive now to the environment because of having 3 pets go through cancer, and we have a lot of spray in this area. So I'm like, okay, well, when do I need to detox my pets? Okay, let's make sure they're on like chlorella and spirulina, or, Adored Beast phytosynergy. Let's make sure we're getting, omega-3 fatty acids into them to help like cell membrane and reduce inflammation. Let's make sure, we're rotating different probiotic strains and getting digestive enzymes. And it's not something I do every single day, but my cats are getting different things to support all of those systems, and making sure like I'm addressing like my stress and my emotional health, so I'm not rubbing off on my cats and making them crazy too, which would affect their gut health
It
also.
does.
So,
Yeah.
and that's the biggest thing that I always try to teach pet parents is like, these are all things that you can kind of tap into and assess every day. Like it's like a tick, right? You can check it off. Like, how did I do today? Like, okay, their food's great. I've got them on a raw diet or a species appropriate food, or well, maybe I need to improve that area. Like start with one small step and then work your way up. It doesn't have to be a massive overhaul. It's just like ourselves. You're more likely to follow through by just maybe you're using a cleaner that like you wouldn't want it to get on your skin, like throw it out, get a natural cleaner, or use baking soda and vinegar, those types of things. Like start small, work your way up, and all of a sudden you've got like an amazing holistic environment in life, and it's going to benefit you and it's going to benefit your pets.
So much, so much. Janelle asks if I use colostrum with bone broth for my two dogs and their immune system. Oh, I lost it. Sorry, Janelle. Where
Oh,
did it
here, I
go?
see it on the side. How
There's
long can we stay on it during allergy season? Can I use it all summer? 100%. Here's the thing though, if you have to be a little bit careful with like bone broth. Some dogs, because of the histamine levels, can react to it. So if you find like your pets have allergies and they're itchy and you're using bone broth and they're staying itchy or they're getting itchier, I would take away the bone broth. The other thing too with colostrum's great. It provides immunoglobulins. So those are like your natural antibodies supporting gut health, the immune system. Some pets are sensitive to cow's milk. So you can always switch over to like a goat colostrum. There's a couple great brands, like Mount Capra is one that I recommend in the States that you can easily find online. And they tend to react less to like a goat product, but you can definitely, Janelle, you can keep them on it all summer. Like there's not like a limit. I take colostrum myself like every day and I feel better when I do it. So it's one of those things, like if you feel like they do better with it, continue it. But just keep in mind the bone broth with the histamine levels. It may cause a flare up, or it may keep them a little bit itchy. And so test it, right? That's where we can be our own scientists and do our own experiments at home, to see what keep a journal, see how they're reacting to what you're using. Keep in mind there can sometimes be a delay of like 3 to 5 days too. So keep that in mind while you're playing around with that.
It's really hard to, like, sometimes people when they get on this journey, I don't know if you've noticed this, then they want to buy all the holistic stuff.
We over supplement.
Oh
Who
my
else
gosh,
has
that's
a
perfect.
supplement graveyard? Like
It
I
is.
know
I'm
people can't raise their hand, but like you have your cabinet full of supplements and everything
Yeah,
looks good, and you want to try, and you feel you're doing something right. That's the hard part about
yeah.
this. And so I find, and this is something that we've had to do personally in our own house because my husband does this. I love him dearly, but I'm like, dude, how many more supplements are coming? Like, stop.
Yeah.
Like, we need to make sure this is working. And, with like the cats, like we went through a health scare with one of our recently adopted cats at the end of last year. I thought we had him for 2 weeks and then he like started having all these GI issues. And so, thank goodness I put him on pet insurance when I took him in for an exam, like the day we got him. And we did all the diagnostics. He had an ultrasound. They thought he had cancer, like lymphoma. It was weird. They aspirated his spleen. It came back probable lymphoma. And I was like, oh my God, not again. And then we sent it off to CSU and they confirmed that it's most likely not. And here we are 4 months later and the cat's completely healthy. And so we supported him through that. But now, like, I look at his supplements and I rotate like medicinal mushrooms and
Hmm.
phytosynergy and gut support, but I rotate them. I don't
Yeah.
want to give him all of it because if you start having GI upset or you get itchiness, like, how do you know what's causing what? And you can have interactions, and a lot of people keep their pets on things. I love the principle of like pulse therapy, where you treat for a little bit, you give the body a break, and a lot of times the body will respond better to it. Like this is common with like milk thistle. Take a break for a couple weeks and then restart it, or give it 3 times a week. Like that's the nice thing with supplements. It's not like giving a drug like the seizure medication
Yeah.
where or steroids where you have to give it every single day or can cause a problem if they come off of it. Supplements can be used intermittently, and a lot of times it has better results that way.
How long do you think, like, if you're going to try a new supplement, I don't know, let's say colostrum, how long would you give it before you would say, let's try something else, or to make sure that there wasn't a reaction, right? Because
Mhm.
I see people want to buy 6 or 7 different things. Well, then I'll try this and I'll try this, and they want to do. I say, tell them no, one at a time.
I
But
do
how
3 to 5 days.
three to
Yeah,
five
one at a
days?
time. Yeah.
Okay.
So I start with one supplement, and this is where each pet is different. So it doesn't always work. That's what makes this hard. But if you have a sensitive pet, like you'll know if you have a sensitive pet, like you feed them something different and they react. So you want to go slower. So that's where if you're introducing one supplement, I would wait. I would do it for 5 days, not change anything else. Don't change like food, don't add in new treats. Like it's going to be a slow transition. This is where like patience, perseverance, are so important. If you're noticing a reaction and they're getting worse, like I find sometimes people will say it's like a detox reaction, and I kind of hesitate on that. Like I don't like watching an animal like lose all its fur and get super itchy and get hot spots all over its body. I personally just I don't practice that way. I'm like something's reacting, like this isn't how we should be, like we shouldn't have this reaction. I don't think this is a detox reaction. I think the body's either not ready for this or it's adversely reacting, like an not necessarily an allergy, but or a sensitivity. So then I changed the approach with what I'm doing. So I try not to have pets go through this massive like phase of not feeling well and getting really itchy and hot spots. And so if you're noticing any change, so let's take allergies since it's like one of the most common things we see, is you add in say colostrum and you're like day 3 and you're like, oh, they're getting a little itchy. Go longer. So this is where do not add in something else. See how they go, double that time frame. Okay, we're at 6 days and you're like, okay, are they a little bit itchy? Let's go a little bit longer. Like remember, we have our pets' entire lives ahead of us. Like we don't have to rush this process. And so just keep them on it for a little bit longer. And if they're doing okay, or here's the other thing, decrease the dose. Go to half dosage and see how
That's
they
a
do.
That's actually really good advice. I know animal biome, the poop
Yeah.
pills, the fecal microbial pills. A lot of times we have to do half doses
Yep.
because it's just very, very rich. Um,
Yes.
so, which is hard though, because they don't want you to open up those capsules. So, what we would do is instead of every day, we would do every other day. And
Yeah.
so,
You're
and make
giving
it
them a
that way.
break.
Yeah, give them a little bit of a break. And it seems to work that way to just kind of go down to like just a half dose kind of thing. I love
But
animal biome.
yes, the other thing you could do with those too, because it's an enteric coated capsule, correct?
Right.
I believe, yeah. So you could actually buy enteric coated capsules and you could actually separate them and do half and
Ooh, that's a good idea.
that's another option that you can do,
I
or
didn't know
just
you
do what
could
you're
buy
doing.
those capsules
Yeah,
and do
I
that.
know this from my husband. So,
Oh,
so yeah,
see?
you can definitely buy, you can buy like the gelatin and enteric coated capsules, and then you can just open them and close them. So I've used that with like using essential oils.
That's a
But
really good idea.
yeah, I find also with your detox supplements too. Like I find, like I love Adored Beasts too. They're
Yeah.
a great company, but I find like their liver tonic is pretty strong for a lot of pets, especially
Yeah.
since I'm seeing, a lot of really sick pets. And so I typically will start them at a quarter or a half dosage. And then we either see how they do. And if they're doing great, we don't need to get up to like the full dosage.
Yeah.
Let's stay on that. Same with like, we use a lot of ion gut biome
I
also,
love Ion.
but a lot of pets react to it.
Yeah, they do.
So, yeah, I find
I
a
use
lot
it
of
for
pets,
myself.
yeah, same here, but I find a lot of pets react to it. And
Yeah.
so it's something where, for one, like, why are they reacting? And I'm like, okay, are we creating, and it's not a super strong like detox, but if there are a lot of toxins and it's drawing it out and their detox pathways aren't optimized, like, are they truly getting it out? Or also the other question I always ask is, do we have like a sluggish GI tract? So even if your pet has diarrhea, they can still have a sluggish GI tract. And so if those toxins are slowly moving, there's this entire system called enterohepatic recirculation. So what happens is there's a portal vein that goes from the intestines back up into the liver. So if those toxins are coming out, they've got to go through kidneys, they've got to go through the GI tract, they can go through the skin. Of course, they're being processed by the liver. They don't get out in time, they get recirculated back to the liver. They have to be processed again. And if the body can't process it because we have vitamin mineral deficiencies, we don't have, the nutrients to go through those different phases of detox, The body goes, can't do it, stores it in the fat, stores it in the bones, stores it in other areas. And then we continue to have a toxic issue. So it's interesting when we start thinking about like, well, why do they have those reactions? What's actually happening physiologically in the body? And you can start making sense of like, oh, well, that makes more sense. Like I need to focus more on this area and maybe not do the detox and pull everything out yet. We need to make sure we are healing leaky gut. We are getting the right foods in, all of that stuff.
Yeah, leaky gut. A lot of people are still struggling. Maybe you can explain that a little bit to us.
Mhm.
People have a hard time understanding what leaky gut is. You tell us a little bit about that?
Yeah. So when we refer to leaky gut, so it's essentially like it's like a gut lining that's inflamed. So the gut itself, when we think about the lining of the GI tract, it's only one cell thick. That's it. That's all that separates the food, the bacteria. That's so the gut health is an entire ecosystem. So it's made up of trillions of bacteria, protozoa, fungi that hopefully in an ideal world are all working together. They're doing the things, they're making hormones, they're making vitamins like vitamin K, B12, they're making like melatonin. So all these things are really, really essential for the body. And if things go wrong, so say, for example, glyphosate. Glyphosate is an antibiotic. It's actually the most commonly used antibiotic in the world. So yes, we use it as an herbicide, but it works specifically on the shikimate pathway of our gut bacteria. So it kills them. And so what happens then is that we have overgrowth of bad bacteria. So the bad bacteria outnumber the good. So this creates inflammation. So the gut lining is made up of all these tight junctions. So it should be like this. It should be nice and tight, right? Nothing's getting through that's not supposed to get through. But as the gut lining gets inflamed, it starts separating. We have things passing through. So what we now have are food particles that aren't broken down, bacteria, toxins. So it's leaking through that gut lining. What's on the other side? That's the circulation system. So we have the blood vessels right there. So what happens then is that the body goes, whoa, there's something foreign here. And it mounts this massive immune response because it's not supposed to be on that side. The body goes, this something's wrong. So we have all these white blood cells. The body produces what are called inflammatory cytokines. And this is where we see like food sensitivities, like your pet reacts. That's part of this leaky gut. This is also where a lot of people don't realize like the itchy skin is actually related directly to leaky gut because that bacteria, the food, the toxins that are causing this reaction on the other side, where do those inflammatory cytokines go? They go to the skin. This is also one of the number one organs of detox. And so we start seeing itchy skin because we have increased inflammation. Those inflammatory cytokines, the inflammatory response is creating more things like histamine. So histamine, creates itchiness, redness, more inflammation. Then what happens? Dogs, cats too, start scratching, chewing, and they create more inflammation. And so now you're stuck in this like crazy inflammatory vicious cycle. And what we do is we go to the vet and they go on drugs and it treats that pathway, it treats the inflammation, but it completely missed the leaky gut problem. It completely missed that we have toxins. It completely missed that we have dysbiosis. We have this overgrowth of bad bacteria. So then your dog comes off of Apoquel or Cytopoint injections wear off, or the steroids, they finish their course, or their antibiotic, they treat the secondary skin infection with an antibiotic, and it comes right back. Maybe you have a couple weeks, maybe you're lucky you get a couple months. And you're all like, this is so frustrating and it's expensive. And this is why you get stuck in the conventional vicious cycle because we completely missed that leaky gut and the root cause of the problem. So I hope that makes sense.
It was so well done. So well done that as you're speaking, I'm like, why aren't you teaching vet school? I'm serious. I'm like, you give such, I have heard so many explanations of leaky gut and I struggle sometimes to get people to understand how important that is to address that situation. But you explain it so well. I really think you should be. I mean, I don't know if you're a very good.
I don't think they'd like me in vet school.
Well, you know what?
Maybe
When are we going to come
we'll
up?
get the vets to come into my program and I'll just take them through that. Cause that's, I
Yeah,
mean, gut health is an entire module. So I've taught a lot about gut health in my program. So, and I love it.
yeah.
I mean, it's so important to me too, because my husband has IBD.
Oh
Like,
my
and
gosh.
he has leaky gut, like he
Yeah,
has dysbiosis. And this is where also I find it so fascinating because I see so many cases. I attract IBD cases in dogs and cats. I see some really severe cases, and you have to start thinking outside the box and you have to like really dive in deep. Like, this is where it's so fascinating, like even digestive enzymes and the pH of the stomach. A lot of times these are off in the body, and we have acid reflux happening and it's being misdiagnosed. And then what's happening is they're being put on antacids and it's making the problem worse. And now pets aren't breaking down the food, and then food is stagnating and it's creating more leaky gut issues. And it's so then what we have to do is we have to look at how do we manipulate the pH, and how do we, because if the pH isn't low enough in the stomach, we can't have conversion of the digestive enzymes like
right.
pepsin to break down proteins. And so now all of a sudden we get these dogs. I mean, we're seeing it right now where dogs do better on a vegan diet or a
Hmm.
vegetarian diet.
Hmm.
Like, I've had patients that I don't advocate for it, but this is exactly what's happening.
Yeah,
Like, our dogs should not do better on a vegetarian diet. And I
right.
believe it comes down to, like, we have a pH problem and a digestive enzyme problem. And we probably have a hormone endocrine immune imbalance too. We've been doing a lot of different testing and are finding a lot of these endocrine immune imbalances that pets are born with because of the changes in genetics and the toxic world, all these things that are playing a part, but we're missing it. And so then what we're doing is we're putting these dogs onto vegetarian diets, and it's like, well, why don't we just fix their gut?
Hmm.
Like, we need to provide the digestive, like, our dogs don't have a lot of digestive enzymes to break it down, so they might feel a little bit better, but are we truly optimizing their long-term health on these diets?
Yeah,
So that's the thing. We don't have a lot of studies on the long-term effects of what these diets are going to do, and that scares me.
yeah.
So, I think truth will tell in 10 years, what will happen, or
It
less. I
is
don't know.
scary. I did a podcast with Dr. McCarran, who is an advocate for vegetarian diets,
Yep.
and I thought it was fair to bring him on. He's a brilliant guy. He's been
Yep.
around for a long time, and he supports the vegetarian diet. And there's a lot of really good information in there. And you're right. It's sad that he's not wrong. There are animals doing better
Mhm.
on vegetarian
Yep.
diets. You
I agree
can't
with that.
disagree with that. But you're right when you say why. Like, here we go again. Why are we taking a carnivore or obligate carnivore and they're doing better on a vegetarian diet? There could probably be a lot of reasons why.
Yep.
But we should be looking at that and finding out, is it because their gut isn't able to break it down? But giving them the hydrolyzed, come on, like
Oh,
that's,
no, no, that's not really food.
yeah.
Like,
So
those prescription diets, like, they blow my every time I have a patient that comes to me on them, and you kind of like forget, they're bad, right? And then you
yeah,
like look again and you're like, oh my God,
yeah,
this is so bad. It's like
I know.
cornstarch, and you're like, there's like no meat, there's like nothing.
Nothing,
Like,
nothing.
I don't know how, like, well, I mean, I don't see a lot. There are pets that can do better, but my question once again is like, we're missing something.
Yeah.
And so, yes, it's not an easier path. And sometimes it's more, well, I mean, that food's like really expensive and there's nothing in it.
So
But
expensive.
yeah, I'm always asking, and I don't always have the answer, but I'm always asking, there's something we're missing. What could it be?
Yeah.
And, I truly believe that our immune systems are amazing. We're so good at healing when we give our bodies what we need. And there's a lot of like confusion, there's a lot of noise out there, and it can be hard to navigate that. And I truly think for people and for pets that applies. Like,
Yeah.
I follow Dr. Joe Dispenza. I don't know if you've heard of him.
Oh
He's on the
no.
human side. Highly recommend looking into his work. So he was actually a human chiropractor, and he was hit on his bike. He was doing a race. He broke his back,
Oh,
and he was like paralyzed. And they said, you have to have this massive reconstruction surgery on your back. you're most likely going to be paralyzed from the waist down for the rest of your life. And he's like, nope, not doing that. Like, I'm going to do so he literally laid flat for 6 months, recovered. And every single day he visualized and meditated his body building itself back together. He's
Whoa.
completely healed now. And now he teaches people how to do that. And he has people sounds really woo woo, but this is what's really cool about him is that he has universities doing research and doing brain scans just show the physiology of what's happening when
Oh,
these
I love
people
it.
are doing the meditation, and how like it's tapping into like another kind of realm essentially to give your body what it needs to heal.
That's
And
amazing.
it's like it's incredible, and that's what we see when there's a lot of energy workers in this field, and you hear some of the stuff and it's kind of like it makes you uncomfortable, right? But
Right.
then you see the results they get and you're like, well, how are they doing? This is not a placebo effect.
Yeah.
And so I think that's where like I always try to stay open-minded and like learn more, because I find it so fascinating.
It
And if
is
there's like a clue to help one of my patients or help myself or help my pets or
fascinating.
my husband, like my family, my friends, like, oh my gosh, then that make
Well,
that like
that's what's so great about the holistic veterinarians is that dogs don't have a placebo effect. They can't. They have no idea that you put
yeah.
that in their food. They don't know what you did. They don't know anything. So when that's where I can be so strong with it. Because I'll be honest with you, a long time ago, my mom, this was before I was on my path that I'm on now, my mom started doing acupuncture, and she was, oh my gosh, it was the greatest thing. She was very excited about it. I thought she was crazy because my mom's a little on that side anyway. So it's hard, especially when they're that close to you. I just thought, oh, someone's getting my mom's money,
Yeah.
because she's that girl. She's that person too. Like she'll just buy into anything, anything.
Yeah.
So I didn't for the longest time believe it until a client brought me a dog I watched him go from not being able to walk to walk. And she
Yeah.
really didn't do much other than the acupuncture. And that's when I'm like, well, that dog doesn't know what they did.
No.
So you start to really believe that. So, but hearing that people are doing studies, because how many times have you heard?
God. Well, then here's the thing. This is why, like, I love Dr. Karen Becker. I
Yes.
love, oh, what's her name? Dr. Helsinki over in, I think, Norway or Sweden.
Yeah,
She's
I
doing
don't
a
know.
lot of the raw food studies too. And just like, Rodney Habib being a
Yeah.
huge advocate, getting things out there and,
Yeah.
turning this information viral. Like it's helping with the movement, and it's helping, Dr. Connor Brady's book, Feeding Dogs. Like
Yeah.
every dog owner should
Should
own
have
that
that.
book.
Yeah.
Yeah, because it allows you to have a conversation with your veterinarian and show them research articles. So, we were talking about vegetarian diets, and that's where he goes into the science and like the physiology. Like, yes, we have adapted dogs with us over time. They have evolved a little bit with us, but they still don't produce a lot of digestive enzymes to break down like the cell walls of plants. And
Right.
so it's still like in their teeth structure, also, they're not omnivores. So it's, having that information to be able to talk to your veterinarian, and rather than going in and having a battle, and it's like super stressful. And that's why like a lot of people don't go, because they're like, screw that. I'm not going to go and have a fight.
Yeah.
It now allows you to have an open conversation and be like, well, what are your thoughts about this? I read this, there's all this research, like, let me bring the book to you too. Like, I can leave it here. You can have a read of it. I can gift you one, gift it for them. And what happens then is when we're able to start having these conversations, that's where the change happens. It may not be the first time, but you're planting seeds in like veterinarians' minds, like, and they're going to see the changes that are occurring with your pets too. The allergy cases where they're on a kibble and they switch to a raw, and they see the next time you go in, they're like, what do you do? And you're like, I changed to a raw. So even if they said, oh my God, why are you doing that? You're going
Say
to kill
well.
them. You could say, it's the only thing I changed, and they're feeling so much better. Here's
Yeah.
this book. I highly recommend reading it. It's how I balanced my diet so that I knew I wasn't causing harm. And there's a lot of research in it. I think you'd find it helpful. So rather than like getting upset, like it's like,
Yeah.
here's the info, and like, I highly recommend reading it. And, I'm using a balanced diet and I'm following the science.
Yeah, no, that's really a good, really great advice. I know that Dr. Roman, um, someone gave her a book one day and said, can you just please just read this book? And so she tells the story about how she was kind of like, meh, you know, no one's going to tell
Yeah,
me.
why do you have to, like,
Yeah.
why would they give that to me? I'm a doctor,
Yeah,
right?
like
You
how
know?
dare you? Like kind of she
Yeah.
tells the story that she read it and that started her journey and
Yep.
her being more open minded and listening and it's just one of those things. So don't be afraid to, for those of you who are listening, don't be afraid to help us plant these seeds. So
Yep.
I did a very small expo. I don't even know if I can call it an expo. It was, I just had one speaker come out. This was several years ago. And I tried to plant the seed and it was not a good experience for me, but I still will continue to do it. I invited every single veterinarian in my area to come. I did it on a Sunday. I did it was no charge to them. I offered champagne and lunch. Like I was willing
Wow.
to do anything to get these veterinarians to listen to Dr. Richard Patton,
Oh,
who,
yeah.
if you know who Dr. Patton is, he's a bioscientist. For those of you who are listening, he's a bioscientist who creates species appropriate diets for all sorts of species, not just dogs and cats. And so I thought, okay, you guys keep telling me that all these vets are just crazy. And no, how about a bioscientist? Will you listen to him? And, I didn't get, there was only one veterinarian that showed up. And for those of you who live locally, her name is Dr. Leong. And she was the one veterinarian who was willing to show up and go, you know what? I'm going to listen. And she did. And she was amazing. And so, but I think I sent that invitation out to probably 50 veterinarians. So it was really, really sad that they don't want to learn, but we have to keep doing it
Yep.
because even just one little book, just even if they read one chapter, like,
Yeah, it's
you know,
planting a seed. And here's
yeah,
the thing, I don't want anyone to go through like the journey we've been on. Like
no,
once
no,
once you have an autoimmune disease, it's really hard to get like into remission and
yeah,
like keep it away or like return to what you were used to. And however, the field that we're in, I mean, we have the highest suicide rate,
yeah,
stress levels are crazy. And here's the thing, if they don't start realizing that there's a different way to look after your own health, we're going to unfortunately see a lot more people have the journey that I went down, but it's going to be their own health breaking.
yeah,
And so unfortunately what will happen is a lot of these people will be forced into finding another way because they're going to find conventional medicine is broken
mhm,
and it's not going to heal them. And I hate saying that, but with the amount of stress, piled on now with everything, and then just not taking care of ourselves and not really focusing on like how do we achieve optimal health. I think unfortunately we're going to see more and more human illness, and that will be veterinarians included. And
yeah,
so if they don't like, I really hope that there is more openness and they start looking at it like there is something here. I have to tweak and adjust. And one of my clients, I love her. She's a newer client. Her dog has protein losing enteropathy, had it from the day one. Like she like rescues all these animals that have like all sorts of health conditions. She's just amazing. She's a human surgeon.
oh
And
wow,
she's like, this path is so hard. I just want to cut it out and remove it. And I'm like, but she's like, I thought this stuff like didn't make sense. But as I've learned, I was like, this is so powerful. And she's like, I have to completely shift the way I think and what I've been trained. Because you think about it, like she just cut stuff out and she goes, yeah, and it's fixed. Like
yeah,
it's done. I don't have to deal with it ever again. And she's like, that's not the case with all like my pets. And so like hearing her say that, like it's nice seeing someone in that realm in the human world. And I think we're going to see more and more, but I think also just with the way it is, people will have to start shifting if they want to feel good, if they want to feel better, because it's a crazy world out there. Like I don't,
yeah,
I don't
no,
trust the pharmaceutical industry. They don't have your best interest at heart,
no, not
you
at all,
know.
not at all,
It's all about money, unfortunately. And so that's where we can empower ourselves with the tools and the food and relieving stress and making sure we don't have the toxins as much as we can in the environment. And that goes such a long way for your own health and your pet's health.
yeah. You're amazing. We're a little bit past the hour that I try to grab your ear for a while and get some information out there. You're just such a beautiful person. I don't want to sound like it, to have people who are willing to come on here. I don't pay her to come on here and talk to you guys. Like, it's just a thank you, because we don't have access. We talked about this before. The whole United States does not have access to the Katie Woodleys of the world. And so they're willing to come on here and talk to you guys. And just, so I encourage you to use her services if you can to help, because obviously it's, we all need to eat and live. So I know
well, we need to take care of our pets. They need us strong. We can't pour from an empty cup.
It does take, this conversations, because sometimes just these conversations are enough to make somebody go, I didn't think about that, and maybe I should think about it. And you're right, surgeons, you go to the veterinarian, a lot of times your veterinarian is your surgeon, is your general practitioner, they're everything.
Yep.
And so sometimes if they're in that surgeon mode, I know my own doctor, I was having gallbladder problems, and he sent me to a surgeon, and I look back on that and I'm like, did I have to have my gallbladder? I asked him, is there any other
they don't know
choice? Yeah, he says you could die. Those were my only choices.
You either let me cut it out or you die.
I'm not kidding. Those were his two. And it was still young in my journey. And so I thought, well, I don't want to die, so I guess take it out. And I had my gallbladder removed. But I look back on that now and I think that probably wasn't the right choice.
I mean, that's something that's been said to us along this path is, when there's inflammation in the gut, and they say, if you don't get this resolved now, we're going to have to cut it out of you. And I'm like, well, then what's going to happen when you have no colon? Like,
right.
Wear a bag for the rest of your life and you don't absorb anything. And that's where like vitamins and hormones are made. And like, it's like, oh my God, like that is last ditch effort. Like that will be the last thing we do,
Well, I was in so much pain at that moment. I mean, he could have told me I had to cut my right leg.
That's the thing. Like, I mean, and too, like rupturing and things like that. Like,
I look back on it though. I bet I didn't have to. It wasn't ruptured. I was in a lot of pain, but I bet I could have. Now I probably could have went to one of you vets and you would have fixed me. I would have said, what would you do?
Some beetroot and some other stuff to help with getting with price sludge and stuff. But I mean, that's the thing. Like, what you know at the time of that journey, and we like beat ourselves up over that. I look at the things now, like looking back at Finn, I'm in a much better place where I'm at. Like, I'm still emotional when I talk about him and share his journey. And, I cry over him because he's such an amazing dog, and he'd probably still be here. He would have been like 15 years old, but it's one of those things that I knew what I knew at that time, and I did the best that I could with the information I had. And it's what we do from that point forward. Mm-hmm. So that's where like Finn was started on like kibble. We did the vaccines. I was bad with his flea and tick preventatives when we lived in New Zealand. Thank goodness I didn't do it as frequently as I thought I should. Yeah. And it's one of those things that I was doing what I was taught. And now like our cats are very different from what our other cats were raised on and how we treated them. And, our house, like my husband always jokes, like we have a cat house now. Like we had like one cat tower and like maybe a cat bed, but now I got like a ripple rug. I've got all these toys. I just bought it's insane. And my husband's like, really? And I'm like, yes, we have to enrich the house. But it's so important, like for them, they can't go outside, and that's such a huge part. It's an entire pillar of health, physical health. And so, it's important that we help them, or else it can create imbalances that can lead to disease down the road. And it's just that I know better now, and all my animals help me see the way and see the light, and that's how they live on.
Yeah. No, Finn definitely is a huge catalyst for everything that you're doing now, because what you went through with him, look at how many animals you've helped because of that. I look at that and I just think, because I also had a dog that was a journey for me that I learned. It was flea and tick. I had a dog die from flea and tick. I know her seizures were caused by it. I didn't know then. I am convinced 100% now. And so when people ask me about it, I'm very adamant. I'm sorry. I can't ever, there's no reason that I will agree to say, yes, you should use that flea and tick stuff on your dog. I can't.
I can't either. Now, I mean, we got a call the other day that some she's a non-client, and she was calling asking for help because she gave a dose of Simparica first time to her 10-month-old golden. And I think it was like 3 days later, started having seizures, couldn't walk, and the dog was in the ER, and she's like, I don't know what to do. And I'm like, got a detox.
Have
Like, you
you
have to
noticed
detox.
that now they're doing like the 6 month ones, and like now you only have to give it to them every 6 months. So that's what they're making it sound like, that is somehow better. It's better that it's going to last 6 months in the body. And I'm like, oh my gosh, it's just that much worse to me. It's just that much worse. It's that much stronger in the
Yeah,
first few weeks, right?
all it takes is one dose. Like, even if you've given it before in the past, it doesn't mean that something bad's not going to happen. It's like, it's this threshold that we get to that if we cross it, that's when the body breaks.
Yeah.
And so you just never know. And it's something that there's other alternatives that we can use. Yes, they're not as strong, but they're safer for that reason.
Yeah.
And, we can use insect repellents that are natural rather than insecticides that are also harming the neurological system of our pets.
Yeah.
So yeah, those drugs, I mean, they just came out with an FDA warning. I was like, we've been saying this for years. Like, where have you been? So
Yeah.
it's a
The
joke.
FDA took way too long to come up
Oh,
with that.
ugh.
Oh, I know.
That's
We
why I
could go
don't
on.
trust them. I mean, take it for what it's worth, but that's why you have to do your research and you have to be your own advocate, because we can't always trust, what they're saying. And, we have to protect our own health. That's all we have. You only have one body. And so if it breaks, it's a lot harder to rebuild it.
Yeah, and our dogs aren't with us very long. Real quick before I let you go, I just want to touch on what you just said. Just because they didn't have a seizure the first time does not mean that they won't. The reason I want you to touch on that is because I just posted, it was actually from Dr. Karen Becker and Dr. Rodney Habib about, or no, I'm sorry, it was Dr.
It was probably Judy Morgan.
It was Judy Morgan. Did you see
Yep.
that? Caught that? I think it
The
was a
video.
King
Yeah, I
Charles, or it was a
shared
Carl's.
it. Yeah.
It
Yeah.
was horrible. So I posted that, and of course, somebody, and I don't want to call this person out, but their response was, "My dog's been taking Trifexis forever,
And
and
they're
he's been
fine.
fine."
Mm.
So can you just really quickly let us know how that doesn't mean that they're fine?
So here's the thing. So I'll use my husband as an example because he's so open to me talking about his story.
Thanks,
I mean,
husband.
the what?
I said, thanks, husband.
Yeah, Ryan, he's
Ryan.
wonderful. So, we've always been really, really healthy. He was in the Air Force in New Zealand, and they would be deployed to go overseas to tropical countries. And we literally just looked at his past records. He had 20 vaccines all within 6 months. So
Wow.
he would go and he would come back and he would go for 6 months on anti-malaria drugs and doxycycline to kill whatever potentially was in him. And he was still fine. And then we moved overseas. So we came back to the States. So this was all in New Zealand. New Zealand is much cleaner than our country, like food wise, how they raise their animals. They're all like grass fed, organic. And we moved to the States 6 months after moving here. New job, stress of leaving, price, like contamination from food, IBD. It doesn't make sense always. And this is why, like, if your pet, you're using a toxin. So, yes, they were fine that time, but also their immune system was stronger. So, you weaken them a little. And what happens, we have this threshold. So, they're inching closer. Let's say their immune system's struggling. You give them a vaccine, we're stimulating the immune system, we're bringing them a little bit closer. Next month, we give them a heart guard. They go a little chemical. So it goes a little bit higher, that inflammation in the body. It's affecting gut health, it's affecting immune system. Next month, they get that flea and tick product. Bam. We see a seizure because now the body can't cope. This is like the cup being, is your cup full enough to pour for others, or are you pouring from an empty cup? And so our pets are exactly like that, where we are seeing symptoms and we may not see it. It does not mean, if you do not see a symptom, it does not mean that there's no inflammation in your pet's body. We are on the spectrum and we are constantly moving along the spectrum. So the more you can do to stay down here where there's no symptoms, you want to stay from autoimmune disease, seizures, cancer, like that is why it's so important. I mean, one of the most devastating calls I've ever been on in my entire career was a new client. Her dog went in for an annual wellness exam. She didn't want to do, I think it was NexGard, the flea and tick product. The vet said, I give this all the time, every day. It's super safe. You'll be fine. You don't want to risk tick-borne diseases. Never used it. I think her dog was 6 years old. This was, I think, 2 years ago now. And 2 weeks later, dog went into liver failure. Blood work from that day was completely normal. And the vet, no one could figure it out. She booked a telehealth consult, and I went through her records, and I was like, oh God, this is related. This is I was like, was this the only thing that was given that day? And she's like, yes. And blood work was normal. And I was like, you haven't done anything else. There's no, like, we went through like potential toxins in the environment, food, treats, anything. Nothing had changed. And the vets wouldn't like say that it was related because it wasn't like cause and effect right away. Her dog was literally dying on the phone. It was screaming and she was crying, and she's like, I think she's dying. And I was like, I can't do anything. I was like, you need to go to the, I can't do anything. It was the most horrible experience for every single person involved in that. It was horrifying. And I will never forget hearing that dog. Like, I get chills because it was so horrifying.
Yeah.
It is not worth it.
It's not worth it.
It's not worth it. It
not
is not
to mention the tick still has to bite the dog.
It does. And that's how it takes in the poison. The
so you're not preventing Lyme disease. You're not even preventing it. So
no, and it's yeah. So I know that's a horrifying story to finish with, but I honestly, I'm sick and tired of hearing like,
I'm tired of it too.
It's not going to cause harm. And I'm like,
I'm tired of it.
BS. It's causing a lot of harm.
It is causing harm. That's the definition of my dog is fine, right? Like, what is your definition of my dog is fine?
Well, where are they at in the spectrum?
Yeah, exactly. That's why I wanted you to explain that, because so many times people just they don't want to change. So they start justifying, well, I've given it to him before and he's fine. And so
just because like, it's like the story of saying I feed like Benefil or, you're really old Roy, just because it like, I hear, they live to be 20. Like, well, did they really? But also too, I'm like, if they live to be 20, imagine how long they would have lived if you fed them a higher quality food.
Right.
Like, you know what I mean? Like,
and did they have ear infections and hot spots and skin problems?
And you just didn't like really.
They don't consider that unhealthy.
Yeah. So it's one of those things. We know there's a better path forward. So do what you're able to do.
Yeah.
And that's what's so important. So.
Sorry, I thought I turned my ringer off.
No worries.
So, but anyway, I guess that's our cue to let you go. Thank you so much. I can't wait to see your name on these as we grow. For those of you who are on here and listening, look at Coco said that her dog responded on the second dose of Bravecto. He had a horrible skin reaction, and it's been a long road. Yeah, exactly. Thank you for sharing that with us, because I know Dr. Woodley really wants people to know that just because you didn't see one. Also, so many vets aren't taking new clients. Found an integrative vet 45 minutes from my home, but on the website says not accepting new patients. It's true. That's why we got to get this information. You can join on to Dr. Woodley's. It'll help you guys and start being educated by some of these holistic veterinarians so that you can do a lot on your own. There's a lot of stuff you can do with your pets on their own. They're here to help you. So reach out to them. We'll get all this information. Lori's put all of your information on there so that you guys can contact Dr. Woodley. Hi, Lily. We're just about ready to get off of here. So hopefully you can watch some of this on the replay. But every Wednesday, we're here with one of the vets that I recommend. There's 15 of them, and I can't wait to see you back on here, Dr. Woodley. You're just awesome. I think you should teach some vet school. Open up the continuing education vet school.
Really. We'll see.
You, Dr. Morgan, all of you guys, like, just start a continuing education vet school. That's what we need.
Well, there are programs out there. So we just have to, it's the certifications we went through. So it's just getting more and more vets into those to take the training. I have people reach out to like vets. That's why we're so active on social media, because people see stuff and it's planting those seeds. So good. Everyone here is a part of that mission. And I just appreciate everyone showing up and, taking time to learn more like that. I so appreciate like what you're doing, Carrie, and spreading the word, and everyone here who wants to learn more and just be the best pet parent they can be. So I appreciate everyone for taking time out of their evening.
Yeah, I agree. It takes, we all have a part. We all, pet
We do.
parents have the biggest voice, right?
Yep.
Pet parents have the biggest voice. If you don't go to that veterinarian who's trying to sell you drugs and NexGard and all of these drugs, they will have to listen eventually.
Yep.
So it takes all of us. So thank you so much. For all of you guys that are coming on here and asking the questions, thank you, thank you, thank you. Lori, thank you for putting all this information up. It matters. And I'm going to say goodnight. So have a wonderful night. I'll see you soon.
All right. Thanks, Carrie.
Thank you. Bye, everybody.
Bye.